morning. It's 10 o'clock, and welcome to Lincoln Ware Live. We're here every Sunday morning from 10 until 11, and of course, we've got a great show lined up for you today. The first half of the show, we're going to talk about St. Vincent De Paul. They've got a new location. They're moving into Winton Terrace. We'll talk about that. And then on the second half of the show, my good friend, Dr. Keith Melvin. The doctor's in the house. We're going to take some house calls. Going to make some house calls today, give you a chance to call in, and we'll see if we can give you some good advice from the doctor today, right here on the second half of the show. And we've got Liz Carter, Lamonica Sherman with us from the St. Vincent De Paul. Welcome to the show, ladies.
Thank you.
Now, tell us a little bit of what is St. Vincent De Paul, in case people out there don't know.
Well, we basically have been here in Cincinnati since 1870, long time, and we're just here to help people who are in trouble, who are about to be evicted, who have been sick and haven't been able to pay their utilities, who don't have food. Mm-hmm. We're there to sort of ease their path, and we do that sort of individually, personally, doing home visits, meeting with them one-on-one, and just seeing how we can help.
Okay, we're going to take a quick break and come back. Having a little trouble with your mic, and we'll straighten that out. We'll take a break. We'll come right back. Lincoln Ware Live is a program. We're here every Sunday morning from 10 until 11. And don't forget, coming up on the second half of the show, Dr. Keith Melvin will be my guest. We'll take a break and we'll return to Lincoln Ware Live in a moment. And we're back again live, and we've straightened out the mic problem. So, Liz, how about repeating what you said before, in case people missed that? Okay, what is St. Vincent De Paul?
We basically are a group who go and visit personally with people who are having some sort of problem. It might be they've been sick and they haven't been able to pay their bills, they've lost a job. Maybe it's a single parent and they're really struggling to keep their family afloat. Okay. And we meet with them and try to help however we can. So sometimes that's bringing them some food, might be helping with some rent or utilities so they can stay in their home and have heat for their kids and lights. And the heart of it, though, is that, you're really giving somebody some hope to go forward, that there's somebody that can help them and that can care about them.
And you also have, you have furniture available for people if they don't have furniture or something like that?
Yes, we do home visit for furniture every Wednesday, and then we have conference all over in the area of Greater Cincinnati that go and help people that needs furniture. And we give them vouchers to go to our thrift store. Okay. So we give them dignity because they get to pick out their own furniture.
Okay. Now you say you're going to move a satellite office up in Winton Terrace. Where will that be located?
It's at 4848 Winesty Avenue. It's where the Terrence Guild, it used to be an organization that was there in that community that helped that community out. And they closed last year in September, and we saw the need to be there for that community.
Okay. Now, how can people, if they want to donate furniture and items like that to St. Vincent De Paul, how can they do that?
They can just call our donation hotline, I guess. It's 421-CARE, and we can walk them through the process of anything, any way that they want to help.
421-CARE is the number. Now, is there any guidelines for people who you can help and cannot help, any income guidelines and things like that?
Well, we try to look at each family individually. Every case is unique. Every story is a little bit different from another person's story. So we try to just really be careful, good stewards, but we try to help people as we see the need. I will tell you that the need is just so great. Yes. And for every person that we're able to help, there's a couple of people that we have to turn away because we don't have the resources.
Yeah, things are not getting any, but you just look at the free store food bank, how their lines just seem to just continue to grow and grow, and they don't have enough food to take care of all of their people. So I guess it's not any better for you either.
It's not. It's a hard year for people too. I mean, with the prices and groceries going up and gasoline never did come back down, and it's just really, really tough for people.
All right. 513-381-3838. That's the number if you want to give us a call. If you've got questions about St. Vincent De Paul, if you need help from St. Vincent De Paul, give us a call, 381-3838 or 651-3838. Let's go to the telephones. Let's go to Regina. Regina, good morning.
Good morning, Lincoln.
How are you?
I'm fine. Good morning to your guests.
Good
Hi.
morning.
My question is, I'm diabetic, and do you help people when they run out of supplies with needles, insulin, and what have you?
We have a charitable pharmacy, Regina, that is at our main office down in the West End, and we are happy to see anybody who needs help with their medication. We do a really thorough intake process, so you have to bring proof of your income, your expenses, and bring along your prescriptions. And we'd like to see all your prescriptions so we can really understand what all of your needs are. And then we do our best to help you. It's all donated medication, so sometimes we have to ask your physician to switch to a different medication from what he originally prescribed. But I would say we're able to fill roughly 90% of the prescriptions that are presented to us.
Okay. What street is that on? What's the address?
The address is 1125 Bank Street. It's right off of I-75.
1125 Bank Street. Okay,
Yes,
can
ma'am.
you give me a landmark?
Well, what would be a good landmark?
Do you know where Lynn Street is at?
You know where the Popeyes
Chicken.
chicken on Lynn?
Uh-huh.
Well, it's right around that corner. You turn left if you're coming from Finley. Turn left right there, right after you pass that Popeyes chicken.
And that's Bank Street.
And
Where Bloom School. Okay, I understand where it is.
Yep.
Now,
And
1125.
Regina, I really want to encourage you to give a call down to the pharmacy before you come, just to make certain you have everything that you need so you don't have to make a trip twice. So if you can call down to, I'm going to give you a number, it's 562-8841, and then go to extension 664.
Thank you.
Okay.
Thanks for your call. All right, let's move along. Let's go to Mary. Good morning, Mary. How are you?
Good morning. How are you this morning?
I'm doing great.
Good. I am too, and I'm feeling real good seeing how handsome you look.
Well, that's all right.
I like you in that blue and gray. That's pretty. I want to say, I want to ask them, do you have to be Catholic to get help?
No, not at all. You don't. In fact, most of the people we help are not Catholic. We really don't care what your religion is. We are there to be a help to people who need it, and that's it.
And do you know how many of your the people you help are drug-related relations? Drug addicted?
Are you asking how many people who need medication, or how many people the source of their problems are related to addiction problems?
Right, that's one.
Well, it really, in a way, it varies from place to place and neighborhood to neighborhood and so on. I think it's very mixed. There are those that we see, and you can sort of see that there's an addiction problem, and we try to send those folks on to other places where they can get assistance with that problem. It really depends on getting a person at the right moment in their lives, because sometimes people are just not ready to make a change. And then we try to look at the full picture. If they have children, we may try to help some way that help will get to those children.
I know most of the times you do. And it was another thing I wanted to say.
Quickly, Mary. I got to go. You're blowing in my ear, and it's turning me on.
All right, you take care.
Thanks. I'm glad you like the blue. Thanks for your call. Okay. Let's go to Mary McDonald. Mary McDonald.
Good morning.
How are you?
Fine. How are you this morning?
Pretty good.
Yes, I would like to know for St. Vincent de Paul. I've been trying. I don't have. I lost my ID, and I'm on a fixed income, and I would like to know if they can help me get my birth certificate from Alabama and my marriage license and my husband's death certificate from Illinois.
Okay. Normally, we help with IDs and birth certificates in our main office on Thursday, doing walk-in from 9 to 11. But we don't do any out-of-state because that's a longer process, and we use vouchers.
Okay.
So, but I do know the free store. You will have to call down there, 241-1064. They do help people with birth certificates that's from out of town.
Okay.
Okay.
All right.
All right. Thank you.
Okay, thanks for your call.
You're welcome.
All right, let's take a quick break, and we'll come back. 513-381-3838 or 513-651-3838. Lincoln Ware Live underway, the second half of the show. Dr. Keith Melvin will be my guest. The doctor will make a house call right here on Lincoln Ware Live. Back in a moment. And we're back live. Lincoln Ware Live is the program, and we're talking to Liz Carter and Lamonica Sherman from St. Vincent De Paul, and we're taking your calls at 513-381-3838. And so there's so many different things that St. Vincent de Paul can. You know, I only saw the store.
The barrels.
Yeah, and the store with the furniture in it. And that's all I said, okay, St. Vincent de Paul, and they're looking for donations and things like that. But I didn't think you guys did so much more.
That's the really common view. That's what people think of those thrift stores.
Yeah,
but there's
thrift
just
store.
all this quiet work that we're doing all over the community.
Yeah, okay.
Yeah.
All right, let's go back to the telephones. James, good morning. You're on Lincoln Ware Live. How are you?
How you doing, Lincoln?
Pretty good. What's up?
I want to ask the people of St. Vincent de Paul, do they provide mattresses?
Yes, you will have to call our office at 421-0602. And because the need is so great, we do have a waiting list. So you will have to call until they're able to put your name on the waiting list. Or if you stay in an area where we have a conference at, they will give you that number and they will come and do a home visit.
Oh, okay.
All right.
Yeah, that's what I want to know.
All right, glad we could answer your question.
Thank you.
Thanks, James. Let's go to Willie. Willie, good morning. You're on Lincoln Ware Live. How are you?
Okay, good morning.
What's on your mind? Turn your TV down. It's confusing you.
Wait a minute.
513-381-3838.
Assistance with rent.
Yes, you will have to call down again to our main office. And again, whatever area you stay in, if we have a conference in that area, you will be able to go to that conference. We do have a waiting list for rent because of the great need of rental assistance. And that number again is 421-0602.
Okay, thank you.
Thanks for your call. All right. Now, you want to give that address of the main office again and the Winton Terrace?
Well, the address for the main office is 1125 Bank Street.
Okay.
And then the Winton Terrace office is 4848 Winesty. But the number to call if you need some sort of assistance is 421-0602. That's the number to keep at your fingertips.
All right. Give it again.
421-0602.
All right. 513-381-3838. And let's go to, is that Key? Okay. Key.
Hi, good morning, everyone.
How you doing?
Okay. I just had a quick question for St. Vincent de Paul. I had called down there numerous times to get assistance, and I had got like 2 calls back, but I never got like a message. So I was just calling to see if I just had to keep calling until I got a live person in order to help get assistance, or how does that process work?
Well, yeah. Go ahead, Liz.
Sorry.
I mean, Lamonica.
We do have a long waiting list, and we have right now we have a small staff. And I apologize if you didn't get a call return, but you could call me at my desk phone at 562-8857 Monday, and I make sure that you get the right connection.
All righty, thanks a lot.
You're
Have a great
welcome.
day.
Thanks for your call. And you being the office manager, Lamonica, do you ever, can people volunteer to help you out, or how does that work?
I'm going to let Liz take care of that.
We would love to have volunteers. I mean, the problem with, we do get so many calls, and so often it's a waiting list, and there's so many who need help. And when we call back, if you're not there, often we won't leave a message on your voicemail because we sort of look at this as a private, personal thing that you've come to us for. Right. So sometimes there's been a return call and people don't even really realize that. Okay. So we can always use volunteers who are willing to come down and answer the phone so that as soon as you call in, there's a live person you can talk to. People who can do the same work that our staff is doing, seeing people, talking to them, helping them. I mean, you don't have to be... You just have to have a big heart to be able to do that.
All right. Let's move along. Let's go to Sherry. Sherry, how are you?
Hello?
Yes, how you doing?
I'm fine, Mr. Ware. How are you?
Pretty good.
Yeah, good morning to your guests. I have a question. I had the bilateral mastectomy on January 2nd. I ran out of gauze pads and tapes, and a lady named Julie Behan at the Cancer Society Advocate Program called the pharmacy down at St. Vincent de Paul and sent me a letter telling me what to take with me when I go for requests. They were getting a little expensive because they had to be changed daily, and an antibiotic had to be applied. When we called down there, Charlie told us they don't supply that kind of thing. And Julie Behan was in state of awe because she said, I called prior to be sure that you wouldn't have to be taken down there, which because they have to be transported because other conditions like neuropathy and things like that I have with diabetes.
Okay, let's see if Liz can answer that.
That whole pharmacy operates on donations. So, you know, if someone were to come and donate those materials, then we would be able to supply that request. So there might be a time when we have those things and we're able to supply it, but if those are depleted, then, you know, the next person could call and we don't have it. So it sort of really puts the burden on getting those resources donated, and things like strips for insulin and wrappings and so forth, medical supplies. Those are things that anyone could donate to
And
us.
do you solicit
anybody.
to some of these big pharmacy companies around the country to donate?
We do solicit to them, but we have found that our best success isn't so much with the big companies, it's with the physicians, with private individuals.
Well, what about the people who have old diabetic testing supplies? Can they be used, sanitized, and ordered strips for? Because I've got 3 that I've been with 3 different direct pharmacies that have been sending out. They want to, manufacture and have their supplies. But I mean, like if I started out on one with direct, and then I got another a mail order, they want to do their testing strip. So these are machines that I just had, and I don't know. I was going to throw them all away.
No, don't throw them away.
Well, that's what I want to know. Are they donatable? Is what I'm asking.
The equipment is donatable.
Well, that's what I wanted to know.
We're not able to take medication.
Oh, I know that.
Once that's been in a private individual's hands, we can't take that. But any sort of equipment.
No, I wouldn't be that stupid to take somebody else's medication. But I was just inquiring about the testing equipment, meaning the machine itself, not the strips. They have to order strips. But I'm saying these are from manufacturers like Direct Pharmacy. The other one is called Liberty. They have their own testing machine.
You know, it would be such a blessing.
I got to
we would
run,
appreciate
Sherry.
it.
Okay, thank you, Lincoln.
Thanks for your call. And we might have time for maybe 1 or 2 quick calls to get in here. Let's go to Greg. Greg, how are you?
I'm fine. How are you?
Pretty good.
What I want to know is there any type of way or situation they can come up to help homeless guys with felonies that need housing?
Okay, you talking about homeless, just somebody that's homeless, a homeless vet or somebody like that?
Well, not actually homeless, but, they come up with some type of situation where they can help guys with felonies that need housing.
Yeah. Oh, okay, felonies that need housing. I'm not sure if you help people with housing or not.
Well, we do. We assist people that already have housing that is in danger of eviction. Well, it's a lot of other agencies out here that help people that need housing. And with felony, I know Community Action Agency has a program there for people that have felony records that's trying to get back on track. So you might want to call them, and their number is 569-1840.
Give that number again.
569-1840.
All right, let's go to Mike. Mike, good morning. How are you?
Oh, good. I just want to give you guys there. I know they do a good job because I know a couple families they helped out, and that's a good society, good program that they have helping people here.
Right, it's good to know about, and a lot of people didn't, they see the sign, St. Vincent De Paul, they see the thrift stores, but they didn't really know what St. Vincent De Paul was all about.
Yes.
All right.
I want to thank you guys.
Mike, thank you for calling. And that's why we do this program, to make people aware of a lot of the things that are going on in this town that they don't know about. And St. Vincent De Paul is definitely one of them. You want to give those phone numbers and addresses out once again before we go?
The West End office is 1125 Bank Street. The Winton Terrace office is 4848 Winesty. And the number to call if you need help is 421-0602.
All right.
Also, Lincoln, I want to say that St. Vincent de Paul doesn't just offer people help, but we pray for people. So, because sometimes people just need hope.
Oh, yeah.
They need past the assistance that we're giving them. So it is a Christian organization, and we do have people on staff that know how to get a prayer through.
All right. Okay. Liz Carter, Lamonica Sherman, thank you for joining me this morning. All right. We're going to take a break and come back with our second guest this morning, none other than Dr. Keith Melvin. We'll take a quick break and we'll return to Lincoln Ware Live right after these very, very important messages. Back in a moment. And we're back live, Lincoln Ware Live, the program. And as promised, my guest for the second half of the show, none other than the world famous Dr. Keith Melvin.
Thank you, Lincoln, for having me on your show.
Welcome to the show. Good to have you in here. And already the lines are full on the 381 exchange. If you still want to get in, we've got a second group of phone lines, 651-3838. You can jump on those. 513-651-3838. If you want to talk to Dr. Melvin, the doctor is in the house, and he's here, got his workout outfit on. I think you were on a plane flight, and what happened? You got a blood clot or something? What happened?
No, well, you know, everybody knows that if you are taking a long plane ride, you should get up and move around. And I actually flew last weekend from here to Houston, Texas, and then from Houston to New Jersey, and then back to Cincinnati. Planes were very crowded and so forth. And so I sat against the window, had the window seat, never got up on any of the flights, unbelievably. And I had my wallet in my left pocket in the back. And as it turns out, I ended up developing an acute sciatic nerve condition where I've lost control of my leg. Severe pain in my leg, had to see the orthopedic doctor, Dr. Clyde Henderson.
Yeah.
Had an MRI and so forth. And the MRI showed that I had an increased level of stress right on my sacroiliac joint, if you will, where the nerve comes out, the sciatic nerve comes out of my back and goes down my entire leg. And so my leg has been numb. It's been extremely painful. It's like a toothache. I've been taking all kinds of medications. They gave me steroids, the good kind of steroids.
Okay,
that
yeah,
make
we don't
get
want
better.
you in front of Congress like Roger Clemens.
I got the steroids that make you feel better, and I've had all kind of pain medications and so forth. This has been going on for weeks. I've been in and out of my office several days this week. I wasn't even able to work. So I just wanted people to know that not only should you move around on the airplane on long flights because of the risk of blood clots, but also the risk of developing sciatica if you happen to have something in your back pocket. I never had my wallet in my back pocket, but on this trip, I put a wallet in my back pocket, sat on it for 3,000 miles, and came back with an acute sciatic nerve condition.
A word to the wise, get up and walk around when you're on the airplane.
Absolutely.
All right. Now, you've been out front, spokesperson for prostate cancer. You're a prostate cancer survivor. And let's just start off with that warning to black men and all men, get that prostate checked.
Absolutely, there's no question about it. And I've got my sticker on today, my little pin here says 8-year survivor, and as of January this year, was 8 years having survived cancer. Thought it was a curse, ended up a blessing. The fact is I had my PSA, the blood tests, I had it checked in my own office, hadn't been to the doctor, but I had my PSA checked in my own office. Found out that the PSA was normal, which is 0 to 4, but mine was 2.7. And most of the guys I see have a PSA number such as 0.1
Yeah,
or
that's
0.5.
mine's like 0.2.
Yes.
The last one I had.
Yes, and that's a very good normal number. However, mine was 2.7 the first time I had it checked in when I was the age of 45. Now I'm 55. And then I had a biopsy and everything was okay. But 2 years later, when my PSA was only 3.1, still normal, I had a biopsy then, and I had prostate cancer in 2 out of 6 quadrants of the prostate gland. I had a complete radical prostatectomy in 2000, January 20th, and I have been doing very well ever since. My PSA I just had done in December was less than 0.1, which is what it has to be, meaning that there is no cell around in my pelvic area that is producing that particular substance.
Well, that's good to hear, and everybody should get out. All men should have their prostates checked at least once a year, but twice a year wouldn't hurt either.
Well, you know, certainly men don't want to have the
Right.
digital rectal exam, but you know, guys also don't want to have their blood drawn. I had a couple of guys in my office just this week when I was there, and a great big guy, 6'5". I won't even say his name on television, but he was screaming and hollering because I said, "I think we'll check your blood." He said, "You did it 2 years ago."
Oh, my
I said,
goodness.
"Well, you know, this is 2 years later. No telling what has happened in 2 years." And so what guys have to realize is that they must become proactive and not reactive. Let's check these things out beforehand in case you're one of those who's going to come up with prostate cancer.
All right, let's make some house calls here. 513-651-3838. There's only one line left available, the 651-3838. You better jump on that real quick. Let's start off with Karen. Karen, how are you?
I'm fine, Lincoln, and yourself?
Pretty good.
Hi, Dr. Belton.
How you doing?
What's your specialty, Dr. Belton?
It's Dr. Melvin. What do you call
Oh,
him?
I got it, Belton.
It's Melvin.
I'm sorry.
Okay, go ahead.
I was wondering what your specialty is, Dr. Belton.
Internal medicine.
Oh, you're internal medicine?
Yes.
Okay, my question for you is, when you run, the geriatric doctors have almost just left the state of Ohio.
Yes.
You've only got a few. There are programs that don't accept people unless they're 60 years of age. Wouldn't you agree with me that people are aging faster and that there should be some programs that accept people that are under 60?
Well, I wouldn't want to say that people are aging faster, but certainly as I get older, it does seem like the days and the weeks are going a lot quicker. But I think that's just a matter of our own perspective. But the fact is, we are becoming an older society. There are a lot more people who are geriatric folks than there used to be. And it is true that there are many physicians who no longer practice medicine in the state or in the city, certainly for particular specialties. And gerontology, which is the practice of geriatric medicine, is a difficult field. The insurance for people is difficult. Medicare only wants to provide certain things. They do have these Medicare drug benefits, but there are a lot of holes in there, Lincoln, and a lot of people that fall through the cracks when it comes to actual good care. There's no question about it.
All right, let's see. Let's go to another Karen. Karen,
Hello.
how are you?
Good.
What's your question?
I wanted to ask the doctor, after going through back problems and everything, I've got myself to where I'm taking high medications. I went from Percocet 10s to Oxycontin, and I'm struggling real hard. When I don't have them, I'm really ill and don't feel good. I have a herniated disc, and I'm blind. I got blind at the age of 42, and so that in itself is I'm trying to struggle through living with blindness. And
Is there a specific question?
the back, your back on the back. What do you do to talk to your doctor? What if you want to get off the pain medication totally and without being sick and hurting? What alternative do you have?
Well, I think what you'd want to do is certainly want to talk to your primary care physician. And one of the things that we do have available are a variety of pain management centers. You've got to get enrolled in a pain management center somewhere in the city where they can actually work with you, control your pain medication, manage your pain medication, and if your desire is to get off, they can work with you to try to reach that end. There's no question about it. A person who has chronic injuries, Lincoln, is going to have chronic pain. And certainly, I'll tell you right now, this acute sciatic pain I had has been very difficult for me. And I'll admit that I've had these generic 5 milligram Percocets, and when I'm really hurting bad at nighttime, I've had to take 3 or 4 of them because it just really, taking 2 of them doesn't even seem to do anything. And so I gained a new perspective myself in terms of my patients who have chronic pain, because if you really truly have the chronic pain, you're not just drug seeking like a lot of doctors like to feel. You're actually in pain. And people who are working every day probably do require some chronic pain medication for management and to allow them to continue to exist and work on their job. But pain management through a pain management program is something that I think anybody who has a chronic pain condition should consider enrolling in.
All right, Eric. Eric, good morning. How are you?
All right. How you doing, Lincoln?
Pretty good.
Good morning, doctor.
How you doing?
I'm doing well. I have a question for you. Occasionally, I have I don't know what it is, but smell like ammonia, an acute smell of ammonia, acute smell. And it usually happens if the heat is on in the house, or if I start breathing heavily in some way. And I was wondering, have you ever heard of anything like that? And I can tell that it's not something in the house. It's actually something in my nasal passage, or it seems to be.
Okay.
That's an interesting.
Hang up and listen to the
very
response.
interesting, Lincoln, where he feels like he smells like ammonia, and it may be certainly there are ammonia and products of nitrogen and so forth are part of the waste products of our body, and as we go through this metabolic process and secrete and excrete various different substances that we no longer need, he may be having some sort of an off byproduct of this kind of process. And I would suggest that, number one, he might want to see an ear, nose, and throat physician and have an evaluation from that perspective, and then, of course, get a complete chemical profile. That's what I would do. That's how I would start. But certainly he needs to start with a primary care physician and then referral to the ear, nose, and throat doctor. Absolutely.
All right. Now, what about this diabetes in the black community, in all communities, but especially in the black community? Diabetes is running rampant. What's going on?
Well, there's no question about Lincoln, and I'll tell you right now, I lecture all over the country, and certainly I know you've seen the programs that I've done. I've been to hospitals speaking to physicians and lecturing at grand rounds from California to New York, New Jersey, all the way to Louisiana and the top of Michigan. And my lecture is Current and Emerging Strategies to Reduce Cardiometabolic Risk. Now, cardiometabolic risk, what this is cardiovascular disease, but before you get cardiovascular disease, the person has what's called the metabolic syndrome. Now, the main component of this metabolic syndrome is that your waist circumference, your waistline, which goes around the umbilicus, the navel, is greater than 35 in a woman and greater than 40 in a man. Now, you and I, we just took this little tape measure I had, and we measured, and unfortunately, I told you I had metabolic syndrome.
I was under.
Mine was 42, yours was 39, so you were on the border of probably having metabolic syndrome.
I want you to take our cameraman before we leave.
Well, and so the interesting thing, Lincoln, is that metabolic syndrome is the metabolic syndrome is a precursor to diabetes, and diabetes is a precursor to cardiovascular disease. And black Americans die from cardiovascular disease more than anything else ever, anywhere. No more than cancer, more than murder, more than all those things. So this metabolic syndrome is where your fasting blood sugar is greater than 100. Your triglycerides, which is on the lipid profile, like the cholesterol, your triglycerides is greater than 150. The good cholesterol, or HDL, is less than 50 in a woman, less than 40 in a man, and your blood pressure is greater than 130/80. Now, and then, of course, your waist circumference is greater than 40 in a man and 35 in a woman. Now, those don't seem like numbers that are all that bad, not that extreme, and they're not. But what it shows you is that there's so many Americans that have developed this metabolic syndrome, we don't even realize we have it because we have accepted the way we look.
Right. And then when you realize you have it, it's too late.
Well, there's no question about it. And the one thing about diabetes that people must understand is that a person develops diabetes because they develop resistance to their own insulin. That is the pathophysiology of diabetes. 5 or 10 years before you're diagnosed with diabetes, you have insulin resistance. However, and insulin resistance is driven by obesity. It's driven by obesity. So just being obese and not exercising drives the development of insulin resistance. And if you have insulin resistance, you're going to develop diabetes. It's just a matter of time. Now, to reverse that, what do we have to do? It's very simple.
Eat right.
We must exercise and lose weight. There's no question about it. But the most common component of the metabolic syndrome is that the waist circumference in a man is over 40 and in a woman it's over 35.
On that note, we need to take a quick break and we'll come back and take more calls. We've got Sherry, Crystal, Paulie, William, Curtis, and Sharice all holding on. We'll get to you when we return to Lincoln Ware Live. Dr. Keith Melvin is my guest. We'll be back in a moment. And we're back live. Lincoln Ware Live is the program. Dr. Keith Melvin is in the house, and we're taking house calls, your calls, at 513-381-3838 or 513-651-3838, if ever a line becomes available. Let's go to Sherry. Sherry, good morning. Go ahead, Sherry. How are you?
Hi, Lincoln.
Yes.
Yes, I have a question for the doctor.
Yes.
I've been diabetic for 15 years now.
You what now?
I've been diabetic for 15 years.
Okay.
And I've had high blood sugars anywhere from 4 to 560 in the last 10 years, and he knows what that means. 2006, the doctor said that my EKG was abnormal. Looked like I had mild silent heart attack. She set me up for a stress test. Now, I didn't hear her tell me to go get this stress test. This is 2008, and I had an emergency run to University Hospital. They still didn't tell me my EKG was abnormal. Now, what I wanted to know, they say that some heart tissue have died off when that happens, but the heart has a way of making its own connective pathways to get that blood through. How many times can the heart do that before it gives?
That's an interesting question, too.
Hang up and listen to the answer. Thanks for your call.
Now, and certainly if you have a heart attack basically, there are 4 chambers of the heart, and there are arteries that go through the heart that bring blood in and out and exchange oxygen and so on and so forth. But the heart itself as an organ also has blood, just like all the rest of the organs has blood coming and bringing nutrients to the heart's muscle. When those vessels are blocked, people say, my valve was blocked. Well, it's not that your valve was blocked, but the arteries around the heart develop some clogging, if you will, and that's what causes, if one of them blocks up completely, you will have what's called a heart attack, and the tissue that gets blood supplied by that particular artery may then die. Now, you can have what you would call mild heart attacks, Lincoln, where the blood does cut off to the heart, but it doesn't go all the way through the whole muscle, and so that muscle still survives. You can have just a small bit, maybe just the surface of the heart's muscle may have gotten affected, and the person continues on and lives and does fine. And then they'll get an EKG sometime, and someone will say, it looks like you had an old heart attack. Well, you'll say, I never had a heart attack before, but this is what has occurred.
Just
And
like
that,
a mini stroke.
Mini stroke's the same thing.
You said.
Well, for both of those 2 conditions, and I would say that I recommend to everybody, if you have any risk factor for heart disease or strokes, that is family history, if you're overweight, don't exercise, have high blood pressure, high cholesterol, or diabetes, that if you're not allergic to aspirin, you probably should consider, and you should ask your doctor, should I be on an 81 milligram aspirin every day? And personally, I feel that anybody who has any of those risk factors should take an aspirin every day, 81 milligrams, if they're not allergic to it. Because if you have a heart attack, if you have a stroke and survive, the first thing we'll do is put you on an aspirin. Now that, once again, is being reactive. I believe that we should be proactive. If you know that you might have these things, if you know that you're not exercising and you're overweight and so on and so forth, you ought to take an aspirin every day along with your blood pressure
I take my blood pressure pill, my water pill, and my
Well, I'm taking 7 or 8 pills every day. They're not vitamins, but they're aspirin. I got a little pill for I got 2 things for my blood pressure, and I got 2 things for my cholesterol. And now I was developing insulin resistance because I have metabolic syndrome, so I started taking a insulin sensitizing medicine to help improve that. But the aspirin, I take it every single day, and that's what we should be doing. We should always make sure, if we're not allergic to an aspirin and have any risk factors or any previous heart conditions and so forth, you ought to ask your doctor. But I believe you ought to be taking at least an 81 milligram aspirin every single day as part of your regimen, no question about it.
All right, let's go to Crystal. Crystal, good morning.
Good morning to both of you. I was just kind of hearing what you were saying. I don't know. I think taking few medicines if possible would probably be good. But 2 quick questions. I stepped on a pencil recently, but the lead stuck me in my foot. The lead's not in there, but the color of it is still, I can still see the color. So I don't know if that's bad, but it's not hurt me. And my second question is, I noticed that a lot of dialysis patients are African Americans. Is that true? And if so, why?
All right, thanks for your call.
Well, for the first question regarding stepping on a pencil or anything, certainly I think that should be clean. First of all, it should have been kept well clean. and she needs a tetanus shot if she does not have an updated tetanus
Right,
shot.
yeah,
Now, you need a
normally your
tetanus shot every
doctors
10 years.
would automatically give that to you.
Well, and
you
now
know.
we don't necessarily automatically give because people don't want to have it, and even though they're recommending to do that, some of the insurance companies nowadays won't pay for it electively. So that's an interesting concept. We know that we should have it done, but the insurance company wants me to pay for it for somebody.
Wow.
It's unbelievable. And of course we have to have the patient sign a thing to say if the insurance company won't pay for it, that you will pay for your $40 or $50 immunization. But if she's having stepped on a pencil, she should definitely keep it clean, and she certainly should have a tetanus shot and perhaps have that looked at, no question about it.
Second question she had about dialysis.
Well, there's no question about it. If you go to a dialysis unit, we'll see quite a few black folks in a dialysis unit. Well, the reason why you have dialysis is number one, diabetes, number two, hypertension. Those two things, 75% of people who are on dialysis have diabetes and hypertension. 75%. I like to call it black man's disease. A lot of white folks have it too, but black man's disease definitely is diabetes, high blood pressure, dyslipidemia, and being overweight. We have the metabolic syndrome. 75 million Americans have the metabolic syndrome. There's no question about it. If you don't take care of the metabolic syndrome, you will develop diabetes. Now, along with diabetes, we've seen now people are developing chronic kidney disease. Chronic kidney disease where you feel perfectly fine, nothing hurts, but your glomerular filtration, or the amount of urine and blood that you filter every day, starts to decrease. Well, when it gets down so far, you start having swelling and so forth, and then you got to go to the doctor. We'll send you to the kidney doctor, and they'll start saying, you know what, you might end up on dialysis.
Oh, boy.
And this is what happens in African Americans. Once again, we have allowed the diabetes to run rampant, and we've allowed the blood pressure not to be controlled. Now, the studies show that we're only controlling 35% of people with high blood pressure. But let me say this to the listeners. The studies have shown that Caucasians require 2.5 drugs to control mild to moderate hypertension, and African Americans require, on average, 3.4 drugs to control mild to moderate hypertension. So when people say, I don't want another pill, well, you know what? You may need another pill. Now, what you'd like to do is take a combination medicine where you can have two pills in one copay and so forth, and so we push those kinds of drugs.
What about the one cholesterol and blood pressure?
Well, that's catty.
But I look at the side effects, it scares the hell out of me.
Well, the side effects for each drug is the same. Now, the components of that drug are Norvasc or amlodipine, which is the most prescribed hypertension medicine in the world, and on the other hand, the other component for the cholesterol is Lipitor, which is the most prescribed drug in the world. So these are two of the most prescribed drugs in the world for a condition that will cause you a lot of trouble. The side effects, of course, you might have the muscle aches and so forth from the cholesterol medicine. All of them may do that. And from the Norvasc, sometimes you get a little headache. But you know what? I took it for a while, but I got the leg aching, so now I take something different for my cholesterol. The bottom line is, don't quit medicine on your own. Tell the doctor that you're having a problem and we'll switch to something else. But continue to have your disease treated.
All right, let's go to Paulie. Paulie, how are you?
Hello, Lincoln. It's Paula.
Paula, okay.
I'm calling on my husband. He drink a lot of green tea. I get him some green tea.
Yes.
Is that, doctor, is that very good for the prostate, the green tea?
All right, hang up and listen.
I have one other question.
Okay, what's the other one?
Yes, now, with the universal health care that we was promised by the Clintons for 8 years, and they never did a damn thing. Now, we all should get out there and vote for Barack Obama, because Hillary had 8 years with her husband and didn't do a damn thing.
Okay, Polly, you're going off into politics. Paula. Anyway, answer her first question.
The green tea and the prostate
Yeah.
gland. Well, what green tea is, I believe, is an antioxidant, and certainly we know that what's called free radicals occurs all throughout your body. Those are sort of waste products, and yes, we would like to rid ourselves of as many waste products as possible, but the green tea does not have any specific effect proven on the prostate gland. While we're mentioning the prostate gland, let me say this for guys who are taking saw palmetto. Saw palmetto does reduce the PSA. But the PSA is the marker that you have to indicate that you might have prostate trouble. So it does not reduce your risk of prostate cancer. It just lowers the PSA. Well, that's the marker that you need. So I would suggest to guys who have not been diagnosed with prostate cancer that they should not be taking saw palmetto anymore. And we used to think that was good. If you're going to take something for the prostate gland, it should be lycopene, which is a substance found in tomatoes and tomato products. So what you ought to be doing is eating a bunch of tomatoes in your salad or a bunch of spaghetti without any noodles in it.
There you go. Now, we almost out of time. One question I have to ask you. I heard about, they were saying that men who grill out a lot, that would increase your chances of getting prostate cancer. I love my grilled meat. You know, you got to have the, what's up with that?
You know, you got to, let's face it now, we're not going to cut out everything. And I do like my grilled meat. I like a little grilled hot dog, hamburger, pork chops, steak, etc., ribs. So it's not going to happen. And they've talked about that, Lincoln, but there's been no proof other than the carbons that we see in any kind of situation are carcinogenic. Carcinogenic meaning that they are cancer causing. But let's face it, check yourself. Be proactive. Make sure you get a PSA. Make sure you get your digital rectal exam every year. Now, I've got 2 31-year-old guys that had prostate cancer because their fathers had prostate cancer. So don't listen to anybody telling you that you don't need to be checked until you're 50. I was 47 when I had prostate cancer. If I'd have waited till I was 50, I'd have probably been gone to heaven by now or somewhere. I'd have probably left here, though. So don't wait till that time. And get your PSA and your prostate checked. But to get a PSA, I think a guy ought to start at 35. And if your father had prostate cancer, you ought to get the blood test at 30, even if you're scared of needles.
Dr. Keith Melvin, I'm going to have to get you back in here. We're going to have to spend an hour with you. I mean, we didn't have enough time. The phone lines are still jammed, but we'll get you back. Dr. Keith Melvin, thank you for coming out early on a Sunday morning, spending time with us.
You know, they always say, when you call me on Sunday, you can get free medical advice.
There you go. All right. Let's take a break, and we'll come back and wrap things up. Once again, I want to thank Dr. Keith Melvin for coming in this morning on Lincoln Ware Live. We'll take a break, and we'll come back and wrap things up, tell you about the schedule for the rest of the day here on It's 38. Back in a moment. And we're back live, Lincoln Ware Live. And don't forget, coming up at noon today on Channel 38, it's Gospel Music Presents Great Performances. And the rebroadcast of this show tonight at 8 o'clock on Channel 25, WOTH. And check me out Monday through Friday from 10 to 2 on 1230 The Buzz. And coming up 9 o'clock, Road to Go, an Academy Awards preview tonight at 9 o'clock on Channel 25. We'll see you next week